Assalamualaikum warahmatullahi wabarakatuh. Hi there, I am Dr. Alvini Octavia from the Faculty of Dentistry, Universitas Muhammadiyah Yogyakarta. Today I'm presenting our recent project titled Digital Identification of Caries Risk in Children at TK Aba Sinduadi. And this is my team. I work with my colleague, Dr. Fahma Aldia Kunsputri, SP Pros, and my clinical student, Rafida Salwa Ulinuha and Ersavita Maulani. This project was funded by LPM UMY. I'd like to explain about the background why we do this project. Dental caries is a major global of oral health. According to WHO, it's still being a problem, the most common chronic disease in children worldwide. And in Indonesia, the situation is even more critical. Based on the national survey that had in 2018, the children aged 3 to 4 years and over 90% of children aged 5 to 2 years are affected by dental caries. And this is a serious problem. As a dentist, we try to identify the factor because the caries not only affect the children's quality of life, but it's also causing pain, poor nutrition, missed school days, and even impairing emotional and physical development. To overcome this problem, we try to find tools that call as caries risk assessment tools, and we find the problem and we try to eliminate it where the caries risk is very essential to determine, to identify them in a previous step. And we design a digital caries risk assessment tool not only to categorize the children caries risk into low, moderate, or high, but it also to identify the specific individual factors contributing to the caries. Our tool is based on the validated Canberra framework. It's a kind of caries management by risk assessment, but we try to modify it to become a child-friendly interview images and digital storytelling that is what word friendly to use, and it's also help the educators, parents, and also a dentist to understand both the risk and the factor, and it also making the dentist easy to intervene early and effectively. Our objective is clear. We try to assess caries risk among students in TK Aba Sinduadi using a simplified digital caries of Canberra approach. This caries risk hopefully can be practical, quick, and easy to use, and of course, child friendly. We conducted a preliminary investigation in February 2025 using total sampling method. We involved 30 students that eligible with parental consent. The setting was TK Aba Sinduadi Popongan in Yogyakarta. Our inclusion and exclusion criteria were straightforward to ensure ethical participation and data validity. You can see the process of collecting data and the interface of the web that we design. In this process, the children looks very enthusiastic to use this tool. And this result shows the age distribution of the participant, and most of them is, are 6 years old, and most of the level education of parents of the participant are in senior high school, and the rest from the university. And we also come across that most of the participants has high risk carriers. This picture show that the risk factor like high sugar intakes, dental history of family, and caries finding were identified in the teeth of the children or the more on the oral health, and the protecting factor also less find in the children's assessment. We identified two main contributors: high sugar consumption and lack of fluoride, that as a protecting factor in this app. According to the previous study, children who frequently consume sugar have 1.5 times higher of risk developing caries. Almost none of children had ever received topical fluoride. This underscored the need of stronger community base or for the stakeholder to make a program that may support them to have or receiving the fluoride topical application. Interestingly, we found no statistical relationship between age or parental education level and caries risk, but these challenges, some assumptions are reinforced that consistent behavior and access to prevention are more influential than background factor. This is our conclusion uh, for our project in TK Abel Sinduadi. Thank you very much for your kind attention. Assalamualaikum warahmatullahi wabarakatuh.